right. Welcome to Bright Spots in Healthcare, live from Health. Today we are joined by Scott Arnold. He's the Executive Vice President and Chief Digital Innovation Officer at Tampa General Hospital, one of the nation's leading academic health systems, recognized for its bold approach to digital transformation. So Scott is helping shape Tampa General's next chapter. Scott, welcome to Bright Spots in Healthcare. And let's just jump in and talk about your overall approach to the digital transformation and like what's driving that vision.
Yeah. Pretty simple formula for us. We have really a vision for the health system, and that vision is to be the safest, most innovative academic health system in America. So everything anchors off of that. Everything we do, not just digital transformation, but the way that we serve our community and put our business together. So in terms of how we marry up digital strategy to that, we align everything, to the vision that we have for the health system. And primarily we look at platforms and getting really, really good at laying down a platform that is consistent across all of the assets that we have that serve the community, that serve our patients. So same electronic health record platform, same phone system, same analytics system. So the experience for, the digital experience for providers and team members is consistent, and the digital experience for patients is consistent. We're spending more and more calories on those types of things. Those are important because, that's eventually how we're going to, get to hit our vision to be the safest and most innovative academic health system in America.
Okay. So we've got alignment across systems. Are you on Epic or another EMR?
Epic.
Okay. Same analytics systems, same phone systems. Tell me a little bit about how that is enabling better data integration, better decisions, smoother handoffs, any kind of cost reduction. Like, give me a story here of it in action.
When you're on the same platform with almost no variation, it is so much easier to share information from across the state, from across the nation. Wherever we have assets, it's all connected.
Can we talk about where your assets are? Because in my mind, and those of us who are familiar with Florida, but not intimate with Florida, we're thinking Tampa, St. Pete area. So tell me your breadth.
Great question. So we have, of course, our big academic health system, our big academic medical center is in Tampa. So you're absolutely right. But we actually have hospitals. We bought 3 hospitals that are a bit further north in Florida, up the West Coast. We have purchased some practices on the East Coast of Florida. So, for example, Cancer Center of South Florida, and we've been doing some very interesting partnerships. We have urgent care facilities all over the greater Tampa Bay area. And we manage a hospital just right on Lake Okeechobee. So we've got a lot of assets all over Florida now. It did used to be just the Tampa Bay area, but now it's radiating to other parts of Florida.
Just give me a radius by miles going north, and then obviously to the East Coast. I got that, but going north, how far?
85 miles north, and then all the way across to the East Coast to West Palm.
Okay, great. Awesome. So now take me through some more, obviously much easier to do all of that, as you said. Tell me an example of this in action, maybe with some results. Give me a scoreboard here.
So one of the things now that we see is transplant patients. So whether they're to our south or, of Tampa, the main academic medical hospital where we do most of all of our solid organ transplantations. So whether it's to the south or to the east, the physicians that are, treating patients away from Tampa, that patients that need solid organ transplants, they're doing a lot of the care in those communities, and they're really kind of seamlessly connecting to our specialists, the organ specialists, and then we're pulling the patients over when they need transplant services. It's seamless. So appointment scheduling, same system. Electronic health record, same system. All of the records are shared. It's just a lot easier for the providers and easier for the patients. All of their stuff is in one place.
How long has it been since you've been on sort of one big operating system across the entire system? Like, give me a year.
Sure. I mean, we brought Epic on in 2010. 2010. And as we've accumulated new assets, it's usually not more, it's usually between 12 and 18 months, and we have them on our platform. A great example, we bought 3 hospitals from CHS. We had those 3 hospitals from the time that we closed on those hospitals.
CHS stands for?
Catholic Health System, I believe.
Got it.
Could be wrong on that. Community Health System, something like that. It's a for-profit health system. They've been divesting some hospitals, and we bought 3 of them.
And those are the 3 up the West Coast, North.
Yep. So the 3 hospitals that we just purchased, we laid down our platform inside of 9 months.
Okay.
So we don't waste a lot of time. There's economy of scale of having everything on one, and I don't have to hire special people to deal with the variation. We have, a homogenous team that deals with the platform, and it's just it's an economy of scale issue as well.
So all your pop health tools, your care your care management tools, one big happy family.
One big happy family. And on the analytics side, we do a lot with Palantir. So we've been a pioneer with Palantir. We go back and forth a little bit with Cleveland Clinic on who was the first healthcare client for Palantir, which is our analytics platform. I think we signed about the same time. And since then, Palantir has, they've done a phenomenal job for us. In fact, we've rewired our entire command center and our major hospital with it. It's done a great job, but having all of our assets on the same platform allows that data to flow in. We can create insights for any part of our health system with Palantir.
Okay. So we've been talking for about, I don't know, we'll call it 10 minutes. Could be the longest I've had a conversation without artificial intelligence being mentioned this week, right?
Sure.
So you've got one system now. So how are you guys now? I imagine that is providing you an advantage as for enabling proof of concepts with different new technologies going to allow you to use large language models to do all kinds of things. So talk a little bit about some of the recent proof of concepts that you've had and how they've been working out.
Let's start with the real and easy stuff. So, conversational AI, or even, I guess, borderline agentic AI. We've applied, we've partnered with a company, Hyro, and they've done a phenomenal job applying their technology to our call center. So we were abandoning thousands of calls because we just didn't have enough people to answer the phones. And a lot of the questions were questions that an agent can answer and satisfy for patients that call in. And we had a conversation at this conference here last year with Hyro, and we thought about it. And life got in the way. We got distracted. Then we reopened that conversation back in June. We signed a contract in July, and we took it live in September.
Wow.
So our digital host, her name is Amy. We've given her a name spelled AIMEE. and she sounds very human, but she announces herself as a digital host. We're not trying to fool anybody. And so far, she has answered probably over 100,000 calls since September 24th. And what's been very
will she escalate it to a human if necessary?
yes.
Okay.
Absolutely. So she can only do so many things because we implemented her so quickly. We've only taught her how to answer some basic things. She's not scheduling yet, but she's going to start scheduling next month.
Okay. Go, Amy.
Yeah. And so that's been phenomenal. But the real story here was I was a bit concerned about the change management and what the threat that presents to the workforce that's answering telephone today.
Yeah.
And they have been in such distress that they welcomed Amy in. And the side effect that I didn't expect was what kind of joy that would bring to the humans that actually deal with the more complicated phone calls, because now they're not dealing with people that are angry because they've not been able to get through. There's probably a good 30% of those calls that are coming in that are being handled by Amy, and the human never has to deal with it. It could be like, where do I park when I come to the hospital? What are the directions to get to, your clinics on the north side of town? Amy can give patients directions and text it to them. So I'm very excited about that. That's real, that's real stuff. And, what we have in front of us with the whole system being on the same platform is now we can scale that. All of the various call centers that we have, what's in front of us are consolidating that. So Amy is the front for our entire health system.
Wow. What's next for Amy beyond scheduling? Do we have a plan for her?
So beyond scheduling, there's no reason that Amy can't take on. We own an imaging business, so there's imaging scheduling. That's somewhat complicated, but if we teach Amy right, she should be able to do that. And whatever is too complicated, she will hand off to the human behind the scenes. We are thinking about our switchboards, hospital switchboards, even our technology support center. Anywhere there's a phone that's answered, there's not a reason that we could lift that burden off of our team members, scale our growth with Amy a little bit more affordably than just throwing a ton of labor at it. And taking advantage of a great technology.
That's unbelievable. Sounds great. Actually, an unintended or unexpected sort of benefit that that you surprised me with was the humans working on the team were actually excited about.
And let me just emphasize that a little bit more. They are so excited about Amy that they gave her a cubicle and they fashioned a cardboard cutout of what they think Amy might look like.
Oh, that's hilarious.
So
that's
Amy's
good.
in a cubicle in Tampa.
That's great. Give me one more example of an application of AI sitting on top of this homogeneous system that you've been able to create.
So a lot of people are doing and have done ambient. We've been an early adopter of ambient with our physicians. Microsoft is our partner there, and we were one of 10 health systems to start their journey before they generally released with nurses. So we've been a part of their, beta code for nurses. On the physician side, when we laid down ambient, or at least that feature, one of the, I wasn't expecting a huge return. We were doing it primarily to provide some relief for the providers. I mean, they're just getting hammered at night with documentation. But what we have realized from a real ROI is our attrition has gone down, which means our recruiting costs have gone down. And I've had no less than a dozen physicians come to me and say, you know what, I was going to retire, but since I have this now, you're going to get a few more years I'm going to get a few more years of life out of my career, because the thing that I disliked the most, you've made it easy now. And, So the marker that we're watching now is what's that doing to, kind of the recruiting costs we have to hire new physicians when they retire, they get burned out. The turnover cost, it's high and it's hard to find great physicians. So that's been a nice benefit for us.
I imagine too that patient satisfaction and overall caps and whatever other metrics you care about as far as government reimbursement and all that,
right,
is going to eventually over a couple of years show some benefit too. I know, like when you think about sort of let's say Southwest Airlines, their whole strategy is strong internal culture, transfers over to the customer experience, and I could see that happening too.
Yeah, I hope so. And I think you're right. I think you're right on the timeline. There's a long tail from when stuff happens to when you start to see it show up in metric.
Right. So you mentioned you've got Palantir, Hyro, Microsoft, three partners there.
Yep.
Talk to me about what makes a collaboration truly successful. And for those listening, like, what are some of the core principles you put into place to ensure that as you're driving digital transformation at your organization and bringing in third-party organizations, like what mistakes have you made? And sort of maybe then what's that result in as sort of the Scott Arnold Tampa General Hospital playbook?
Yep. I mean, you nailed it on the partnership. So I don't carry a lot of vendors. We have partners, and we spend a lot of time on developing win-win partnerships together, no matter big or small. So our greatest partnerships are with the biggest players in our platform. And I would say even on the biomedical device side, you have GE and Philips. We have phenomenal relationships all the way up to our CEO and the CEOs of those companies, where we're sharing what's going to make each of us successful, and we're trying new stuff with each other. And when we generate, when we put together, trust like that, it just takes cost out of the time that you spend negotiating or creating something that's transactional. So some of the early mistakes that I made were kind of handling these things as transactions. Now we've shifted to longer term partnerships, really locking in win-win situations, lowering the cost for us, and frankly, lowering the selling and administrative costs for the partners, because they don't have to spend a lot of time selling to us if we're all in.
I've built bright spots and our platform on building trust and relationships at scale. And I think when you say, when you're talking about how you don't think of them as vendors and as partners, and it's all about trust, there's a quote, I think it's Charlie Munger, trust is one of the greatest economic factors. And I think that's a perfect example of that in place. So building CEO to CEO, I'm sure you have a peer across the way at all these companies that you mentioned, Philips, GE, and the other three.
Yep.
Yeah, I think that's terrific. Anything around, besides looking at it as transactional, any implementation mistakes or lessons learned there, or even in the due diligence process that maybe you could shed some light on for all of us?
I mean, we'll be here all night. I mean, over the course of my career, we've made a number of mistakes, but we learn from all of them. And typically in digital health, I would say 99.9% of our partners, they're all reasonable. So if we make a mistake and let's say we sign an agreement that's, 5 years long, which is crazy in technology because it changes so quickly. Most of our partner, the mistakes that I've made have been to go too long on some of those partnerships because you just don't know what's going to change in the middle of that time. But appealing to the better business sense of each seems to work out. It's reasonable. We do very few breakups, but occasionally when we do, there's, a good dialogue between us. We we part amicably. We've had a few of those over the last, I'd say, 3 years, because there are some technology companies that haven't been modernizing their stack for us, and we're moving a little bit faster than perhaps some of our colleagues in healthcare. I mean, the industry moves at a glacial pace as an industry. We're just trying to quicken the pace a little bit, and our partners need to keep up. They need to keep their tech modern and help us out there.
Is there a leader or an entrepreneur or an organization or a book that has personally influenced you in how you have evolved as a leader at Tampa General and as a digital transformation leader within the industry that you could share with anyone, with all of us?
I'm not, there isn't one. I'd say I learn from many, and I'm a lifelong learner, so I'm still learning. I'd say some of the best things that I've learned have been from, philosophies of some of these companies. For example, Apple and the platform that they have built, the seamless platform. When we talk about a Tampa General Hospital, platform, we liken it to, that's our goal, is to create an ecosystem that's, so easy that everybody wants to use it. So philosophically, I like that. The leaders there, of course, but I've learned from my own colleagues in the industry. In fact, the most energy that I get are speaking to, entrepreneurs that have a great idea. It may never scale. And what's sad is next year, 50% of them won't be here, but there's a lot to learn from some of these ideas. So I learned from the entrepreneurs. I learned from my colleagues. I probably learned the most when I come here to these things. It's less about sitting and listening to some of these sessions. It's more about talking to people and technology leaders. So I know that was probably not the answer you're looking for, but
it was a great answer. It was a great answer.
But I learned from everybody here, and we learn from each other, I think.
Learn from networking and connections, and taking a page out of Apple and putting it into a hospital health system. That's pretty good. That was a good answer. Give yourself some credit there. Anything else that you want to share with us before we get out of here?
I appreciate you doing this, and getting my opinion. I'm one data point. There's some great people at the health conference, and there's some great ideas. I just think as an industry, we need to move a little bit quicker to lower the cost of healthcare. I mean, we're on an unsustainable path of 17 to 20% GDP, where you have some other, very well industrialized countries that are 5 to 7% GDP. And so why can't we be there? Why are we spending so much? So, we need digital to help lower the costs.
Move faster, everyone.
Move faster.
Thanks, Scott. Thanks for taking the time out of a busy day and week. And thank you for everyone who is listening. We never take the time you spend with us for granted. And we hope you use the ideas, the insights, the strategies, and the mindset that you just heard from Scott Arnold and apply it to your organization and your thinking. That's how we all get better, folks. Finding bright spots, finding good ideas, and figuring out how to clone it, borrowing it from each other. We produce this show for you. This is your Bright Spots in Healthcare podcast.